Hi, everybody. Thank you so much for joining. My name is Sherry. I'm the founder of Bali Luxe Medical, and I just wanted to give a short intro before we get started and say how excited we are to be here with both Dr. Astri and the BIMC hospital team as well. At Bali Luxe Medical, we specialise in luxury recovery accommodation for post-surgical patients. So I know a lot of you here may have already seen our page and the services that we offer. We really started Bali Luxe after we saw a huge investment by the Indonesian government into making the medical tourism industry boom over in Bali. The quality of the hospitals and the surgeons here in Bali was absolutely incredible, and the industry has been growing so fast. Primarily via word of mouth, people who are coming and then going home and telling their friends. What we noticed though is there was no proper aftercare and recovery facilities yet. So people were having surgery and then sort of left on your own to book your own hotels. So we've been very, very excited to partner with BIMC Hospital. We have a personal passion for health and wellness, and so we wanted to bridge the gap in recovery by providing safe and affordable accommodation and services, but also integrate the best healing treatments that we can get here in Bali that may not be available back home. So that's the things that we offer, like LED therapy, the hyperbaric oxygen. We have lymphatic drainage, massage, and personalized nutrition programs during your recovery as well. We are so excited to be collaborating today with Dr. Astri, one of the most famous surgeons on the island. The entire BIMC team is known for their world-class expertise. They have Australian certifications on their hospitals. They're inspected every year, and it's been a really, really fantastic partnership to be with them and to support their reputation with their recovery care as well. I'm just going to set a really quick agenda for today. We know there's still a few people joining as well. We are going to pass over to Dr. Astri and the BIMC team for a short introduction into their services. And then we have taken a lot of questions from all of you who registered. So thank you so much for those of you who did submit questions. We're going to ask those to Dr. Astri, and she'll be able to answer some of those questions for you. If anybody does have additional questions at the end of the session, feel free to pop them into chat, or you can even PM us on our business page on Facebook at Bali Luxe Medical, and we'll do our best to get through those and get those answered for you. So thank you for joining us again. A huge thanks to Dr. Astri and the BIMC team for being here, and I will pass over. Thanks.
I'm the head of business from BIMC Nusa Dua Hospital. Nice to meet you all. I know it's Saturday morning. It's a beautiful morning here in Bali, and I hope you have a beautiful morning too, wherever you are, especially in Australia. For the Australian audience, hello. As Sherry has introduced us, thank you very much, Sherry, for the introduction. Yes, for those who doesn't know BIMC Nusa Dua yet, we are located in the heart of Nusa Dua in ITDC area, and we've been around since 2012. We are a general hospital with Australian accreditation, ACHSI, from the Australian Health Council, and we provide a complete service as a general hospital, from medical screening, radiology, and then our center of excellence is plastic surgery and aesthetic. And I hope today we can share knowledge and product knowledge about the plastic surgery, and in specific our facelift neck lift with Dr. Astri, one of our surgeons. Yeah, and we are happy to collaborate with Bali Luxe, which provide accommodation, and later on at the end of the session we will also share about the services that we have, in particular in plastic surgery in BIMC Nusa Dua. So I hope you will enjoy the show. Thank you.
Thank you so much, Meeta. So one of the reasons that we wanted to start this webinar and we wanted to run it is because we do have so many questions about the surgical services that are available in Bali. I'm from Australia, obviously. I live in Melbourne, and a lot of us, even who travel to Bali regularly, weren't aware of the quality of surgery or even the types of surgery that are available. I've certainly noticed, obviously, now working in the industry, I've noticed the uplift in the number of people that are traveling to Bali for surgeries recently. But Paramita, perhaps you could tell us the most popular kinds of surgeries that you perform at BIMC in your area, and perhaps how long you've been performing those for with Dr. Astri.
Yes. For the plastic surgery, we have a minor surgery and major surgery. And actually, while we're waiting, there are several questions that are actually popping out at our IG Live. And one of the question is, how long does a patient need to stay in Bali, for example, for a surgery? From what we experience and we learn from the patients who stays in Bali, who has surgery with us, for the minor surgery, usually the length of stay in Bali is around 7 to 10 days. And for the major surgery, usually people stay in Bali around 14 to 18 days. Yeah.
Okay. And what do you class as major surgery? What are those surgery types?
Yes, for the major surgeries, examples is like facelift, neck lift, lipoabdominoplasty, and then apa namanya, breast augmentation. Yeah,
Yeah.
those are the examples of the major surgery. For the minors is blepharoplasty, scar correction, fat transfers. Those are the examples of the minor
Okay.
surgeries. Yeah.
Okay. So for the major surgeries, that's obviously all under anesthetic. Some of the minor surgeries, are they also a general
Mostly a
anesthetic?
local
Local.
anesthetic for the
Okay. Okay.
minors.
Okay.
Correct.
I see. So it's a very fast procedure,
Yeah,
right? Those little
yeah,
ones.
and actually, 2 months ago, this year, we're also launching 1 day liposections. So,
I saw that. Yeah.
yes, you don't have to stay overnight. But
Mhm.
in technical for the procedure later on, Dr. Astri will be able to explain it further with you.
Yes, definitely. Definitely. We'll ask some more detail from her. Okay, that's really interesting. And how
Mm.
many surgeries does BAMC Hospital perform each year?
And that's very interesting questions, because we started these surgeries in 2017. Average, we had like only around 50 to 57 surgeries per year.
Okay.
That would be like 3 to 4 surgeries per month. But surprisingly, in 2000 by 2024, it has grown significantly that we closed last year with 627 surgeries. So that will be like 40-50 surgeries per month.
Yeah.
And in 2025, we already maintain 80 surgeries minimum per month with 4 surgeons that we have now. And I think we're going to continue to have a good year until the rest of this year. And we're hoping to be able to provide at least 100 surgeries per month.
That's fantastic. You've grown so
Yes.
quickly.
Yeah.
I was privileged enough to come and see the BIMC facilities, the hospital down there. It really is beautiful. And I remember when I did come there earlier in the year, you had a new ward, a new area that had been built as well. Is that open now?
Yes, we're planning to open sometimes this year. I think the estimation will be on the third or the fourth quarter of this, or early fourth quarter of this year. So just wait, and we will update you with the progress of the opening of the new ward. And this new ward is actually going to be dedicated or specified only for the cosmetic or plastic surgery patients. so they will have like a more comfortable place to stay in the hospital, and also a nice ambience.
Yeah, and that's really important when you're
Mm.
recovering for a few days in hospital, right? It is
Yes.
quite big surgery. I know a lot of people think it's very easy, and there's a lot of Facebook groups that say it's very easy. You just can come and get your surgery and sort of go home again. But it is very important to recover correctly.
Yes, it is very important. Oh yeah, I think I missed one of your questions. Actually, before you ask what are the most popular surgeries in
Yes.
BIMC Nusa Dua, yeah, actually 90% of our patients are foreigners, and about 70% of them are Australian actually. And the most popular surgery for our patients are firstly is facelift neck lift, and then breast augmentation, and then lipoabdominoplasty are uh, the three top surgeries in our place.
Okay, that's really good. I also have one more question just before Dr. Astri joins us as well. And that is about the Australian accreditations that BIMC Hospital hold. Could you tell us a little about that and the process for the assessments that you go through and how you qualify for the Australian accreditations?
Mm. Yes. We've actually the assessment for the accreditation itself is actually they have audits, yearly audit for it, and then we maintain the accreditation since. Wait a minute, let me see my notes. Sorry.
That's
We've
okay. I know you've
actually
had it for
had
quite a long time. Yeah.
yes, yes, we've actually had the accreditation from the Health Council since about 2013, 2014.
Yeah, more than 10 years. So they audit
Yes,
you
more than
every
10
year.
years.
Okay.
And actually, I had some conversation, like a conversation with some of the Australian patients, and I've asked them like how they got to know us and why they come to us, and they said that BIMC Nusa Dua feels like home to them. And I said, well, that's a very interesting remark. What do you mean by feeling BIMC Nusa Dua is like home? Yeah, because when I came into the hospital, I saw all the facilities, all the standards. It doesn't have any difference with Australian, so it gets so familiarized. So that's very very interesting remarks.
Yeah, definitely. And I think that's part of the reason that we're holding this webinar as well, is to try and, I guess, educate about the quality of the hospitals that are available in Bali. Typically, that may not have been the perception. And I think it's really, really important. Part of the education that we're trying to do, especially, is just to promote that quality of healthcare there is available. And the
Mm.
facilities are truly beautiful. I had a
Yes.
surgery, non-aesthetic, unfortunately. I had a fall earlier in the year and had a surgery, and your facilities are absolutely stunning. The surgeons are amazing. When I came home from my checkups in Australia, they were very, very happy with the progress that I had made and the surgery that had taken place. So I think some people are surprised, but I think it's very important to know what is available.
Yes, and actually, it's really great that our collaboration can work well because,
Actually.
yeah, because what is important is that most of our patients are solo travelers, and
Yes.
lots of them actually, not only one or two, but lots of them are patients who hasn't been to Bali, or they're really seeking for the assistance aside from the surgery or the medical, like the simple thing that they need, like for example, how do they get around, and if they need any assistance after the post surgeries, where do they can get the assistances and things like that. And I think your accommodation, actually you can actually tell more about your accommodation, and actually it's in line with the recovering process for the patients. Don't you agree?
Yeah, definitely. So I will just tell a little bit about this. Just for everybody online, Dr. Astri will be joining very shortly. So with Bali Luxe Medical, we knew I have a background in healthcare and in aesthetic wellness as well. And so we knew that there are things that you can do categorically that will improve your healing process. You'll be able to heal faster. Obviously, there's a base level safety aspect around hygiene and being in a safe and clean environment, being able to rest and things like that. Being able to sleep upright if you've had a facial surgery is really important. But there is also additional things that you can do that will help the healing. It will help the scarring process. It will help to reduce inflammation so that you don't have pressure on the wounds while they are healing as well. So again, that helps your scarring and just your overall experience. And so that's why Bali Lux really was born. We don't promote any particular surgeries. We're not going to sell to you or book for you any of those. That it's a completely personal decision. But what we do want to do is be available for you. When you have booked your surgery, we will take care of everything else. So our services actually start before you arrive in Bali. There's always a call to make sure that you're feeling okay. We can help to settle your nerves a little bit if possible, help you with what to pack and things like that. And then when you arrive, we take care of all of the transport. If you have been to Bali before or anything that you've heard about Bali, one of the things that stands out is traffic. Traffic is very, very busy and can be very unpredictable depending on how many tourists are on the island. And so we take care of the drivers for you, have private cars. For those of you who are having body surgery, we actually make sure the cars are suited to you at that time. So there'll be a lower step up so that you don't need to climb into a van or anything like that if you've had a core surgery or a tummy tuck. So we make sure that they're very comfortable, very hygienic. The drivers are there to help you as well. They're familiar with our services and with helping medical guests. And then that continues on into your care. So for us, diet and nutrition is so important. We always have a very high protein, high nutrient diet for you. Our chefs cater the meals to each person. So depending on the individual, if you have dietary requirements, we will make sure that we take those. We discuss it during your kickoff call and we take those down and work to them. Any allergies, of course, are completely catered for. And we just want to make sure that you have the best possible experience while you're in Bali. If you've woken up from anesthetic and you're feeling a little nauseous or you're not feeling well, you don't want food that is unfamiliar or food that you may not like. And so we make sure that we look after you, especially in those first few days, with a light menu and all of your favorite foods in there. And we will talk to you about what those are. The additional healing as well, and I know Dr. Astri might talk about this because she loves her LED also.
Yes.
But we give daily LED after you come home from hospital. And so what LED does is it's a light therapy. We don't need to touch you to perform that for you, and the nurse will give you your LED treatment every morning. And it helps to really calm down that inflammation and swelling. And it also preps your skin to start producing more collagen and to start healing as well. And so it's excellent for your scars, but even if it's not on the wound site directly, if you still have bandages, it's excellent to reduce that swelling and therefore it reduces the pressure on your wound while they're healing as well. And our patients have reported the difference, feeling very, very comfortable after they've had their LED because it just takes some of that swelling down for them as well. So that's something that we do daily. The other thing that we have just introduced is the hyperbaric oxygen chamber, which again, we're just seeing incredible results. And I think it's something that Dr. Astri will touch on around how quickly we can heal and how we can assist that healing to be done in the right way. So when our skin heals, Dr. Astri will talk more about this, but when our skin heals, it lays down the collagen first, and it can be quite messy and unorganized, and then it will reorganize that collagen and flatten it down. And so the LED and the hyperbaric both assist with that reorganization to give us good scars. So everything that we do is designed to help as much as possible.
Okay, Sherry, I think Dr. Astri is about to join us soon.
Fantastic.
Hello, Dr. Astri. Good morning. Morning.
Hello, Dr. Astri. How are you?
I'm good. How are you?
Very well, thank you. Thank you so much for joining us today. We have given some introductions around Bali Luxe Medical and also for BIMC, but I would love for our viewers to hear your own introduction, who you are and how you started with BIMC and your surgery specialist.
Okay, so first of all, I would like to say thank you very much for inviting me. My name is Dr. Astri. I'm a plastic surgeon from BIMC Nusa Dua. So actually, I started BIMC about, I think, 3 years ago. I already know a lot about BIMC as one of the best hospital in Bali, especially international hospital. We always upgrade and maintain our facility so it's to meet international standard. So our specialists mostly in anti-aging surgery, both from face to body, facely eye surgery, nose surgery, breast, even to belly until arm or thigh. Mostly our surgery is concerned in anti-aging procedure because patient or people always thinking that plastic surgery is about changing. I don't want to be changed in someone else, but actually we don't change. We just restore your face, your body to more youthful appearance, to more presentable, because we cannot lie that good appearance is one of the primary things we need these days, like this.
Oh, Dr. Astri, when you mentioned that we're one of the best international hospital in Bali, we actually just received an award on April 10th as the medical tourism hospital of the year in Indonesia based on Asia Health Award.
Oh yeah.
Yes, that's actually one of our pride this year.
Yeah, even meditation, I cannot say a lot, but if you want to see, you need to come and feel it, because from our nurse, the doctor, every staff is being trained really
Yes,
good to
correct.
meet standard international standard.
Yes.
Even in our surgery room, we always maintain the facility and we always use the best ingredients, best medical things.
Correct.
We don't want to use just like cheap one just to press the price. No, we always give the best everything from the beginning, from the preparation, from the everything we use. We only use the best quality we have.
Correct.
Yeah.
Correct.
So Mita spoke a little bit about the Australian accreditations earlier, and I think that lines up with what you were just saying, and also the awards that you have received around, you have your annual audits, you're checked every single year, and every time that your facilities have been checked, they're at the top quality standard. In some cases, I would beg to say that they are better than some of the hospitals we have in Australia. So Dr. Astri, the viewers here have submitted some questions for us as they registered. So we'd like to ask you some of those. I'll jump into the first one, and that is, now this has actually come from a few different people, a few different questions. So we've joined this together, but it was a very, very popular one. What is the difference between an SMAS and a deep plane facelift? And how do I know which one is right for me?
Okay, so are we directly to Q&A or we just present first?
Yeah, I think present first. We should present first.
Okay.
So
Yeah.
we know the basic knowledge first, then we go to Q&A.
Sure. No
Yeah.
problems.
Okay.
Okay, so can you already see?
Yes, I can.
Okay, so I will start about just a short briefing to give you some pictures about face and neck lifting. As I mentioned before, that I'm one of the plastic surgeon in Bali, and my subspecialist is in aesthetic surgery. So we can see from this picture that we can okay. So with the facelift, actually when we are aging, there is many things happen in the same time. So from the skin until the bone. So you can see from the 35 that still youthful appearance, our skin still full, the fat is still good volume, and then our bone still in good condition. But when we are aging, starting to 40, starting to 30 actually to the 40, everything start to shrink down. The collagen's less, and then the skin is getting thinner. The fat also, the volume also going down. That's why we start to see the aging sign of the aging. Your skin is going to droopy. Your fat, you lost your fat. You have your no volume. The worst case when you reach to the 50, then all together with the bone is going to more shrinking down. That's why you start to feel that, oh, I lost my jawline. I lost my cheek. Why my skin is so droopy? That is a natural process and aging. So this is the skin layer that is very important and this facelift. So we all from the history we always advance the facelift. Actually, facelift is already being done from 100 years ago. That time people thinking how to lift the skin. So actually in our skin, face skin, we have like 5 layers from the skin and then the subcutaneous, and then the most important is the third level, which is a mask. This mask actually is like a thick fascia between the muscle that when we moved this mask and everything is moved together, muscle and the skin above is moved together. That's why in facelift, mask is the most important layer in our surgery practitioner. And then you can see in the picture there is some in the right one, there is ligament. The ligament is thick, it's like stick your bone to your tissue. So the more we remove or the more we cut this ligament, it means it's easier to move the skin. So facelift and neck lift actually designed to leave, correct the sagginess of cheek, jawline, tightening the neck muscle, remove the jaw and the double chin, and also create defined jaw and neck contour. So who needs the facelift? Actually, many patients these days starting to come to us from 20 years old, 30 years old because they see, I want to do facelift, but facelift cannot be done to the patient's very young age because the skin actually good, and many patients if they like pull their skin, I want to be like this. Skin is being there to elastic, so all people, even the baby, if you do like this, of course they need lifting, even the baby, but cannot do the facelift in the baby. So actually we target to the patient starting to 40 years old. When you just 20 and 30, I actually more suggest the skin treatment to maintain and slower the aging process.
Aesthetic treatment.
Yeah. And then until when? Until what age? There is no limit of the facelift. As long as you want to do it and your body fit to the surgery, even 70, you can still do the surgery. And if you have the sign of loose of the face and neck, and you want long-lasting natural result to improve the mid-face saggy, the jaw and the jawline, the nasolabial fold, and the neck, and also the double chin area. So this is the many things people always ask about what kind of facelift I need. May I need the smash or everything else? So the most basic or traditional facelift is the skin only. So this is the most simple one, that we just open the skin and pull the skin and remove the excess skin. There is always plus and minus point in every surgery. The plus point is it's simple surgery, is quick, but the minus one is, as I already mentioned before, actually this facelift will be mean and give good result if we manipulate this mask layer. If we only pull the skin, in the beginning you will see, oh, my skin is good, is being tracted, but it's only for a couple of months, then the skin will start to saggy again, and because of that the scar will be getting wider. That's why the previous we improve the surgery to the to the mini facelift. Mini facelift is more for the patient who is like still mild aging, that the segi is very minimum. So we just cut some skin, but not only the skin, we do some stitches in the mask layer without cut or open the mask layer. This one is only for patients still in young age or very minimum segi, because as we don't open the mask, so it also the long lasting is shorter, maybe just about 3 to 5 years. And then we improve the technique again to this mask lifting. So mask lifting, it means that we do any manipulation to this mask. There is many technique you can choose. That first we just stitches the mask. We call it mask application, or we cut the mask a little bit and directly stitches, or we call it mastectomy. So without opening the mask, without cut the retaining ligament inside that stick your skin to the bone. So this one we just manipulate a little bit in this mask layer. This one also downtime is shorter, more simple, quick surgery, but less long lasting and less natural compared to the deep plane.
How long is the downtime, Doc?
Well, for the downtime of the deep plane is up to 1 year. For this one, maybe just about 6 months. Yeah, so the more extensive we open the layer, the more also downtime will take longer time.
Oh, wow.
And then we move to the deep plane. So why deep plane is very popular these days? Because as I mentioned before, this mass and your skin is being stick to the bone with the retaining ligament. So with this deep plane, we open this mass and we will cut this ligament so your skin and your mass can be moved together. Different with this mask technique before, that we open the skin quite wide. This one we just open the skin a little bit and we wide dissection is under this mask. So mostly we play is under this mask layer. The problem is the technique is quite difficult because directly under the mask layer there is nerve for our facial expression, and we are always afraid to cut or injure the nerve. So when we open the smart layer, we just do it slowly, one by one, 1 milli, 1 milli, 1 milli, 1 milli. That's why it takes a long time and need more concentrate and more high difficulty. That's why some surgeon, of course, they have still good result with this mask, but there is also, if you want more natural result, long lasting results, and you can choose the deep line. Both technique is always there is no wrong and
Right.
right technique. Only who perform it, which surgeon perfect in the technique that you can trust it. So it's just what technique you like and which one is more preferable with you.
Mm.
For the recovery, facelift is take longer time, so you have to be patient. The heaviest downtime will be in your first week. Then you will see like chipmunk, that swelling, bruises, everything like, oh, whose face is this, like alien? It is normal. You don't need to worry because every people feel it. So My suggestion actually to the patient, don't see the mirror. First week, just don't see the mirror. It's not your face.
Avoid the mirror.
Yeah. So just like it's not yours. And then after that, stitches out is 8 days after. In the second week and third week, the bruises will be starting to going down a lot. Mostly 30% of swelling already gone in 3 months, but 100% result you will see in 1 year. Also, some patients feel like, oh, I feel numb, and then what tingling sensation and tight feeling. So this one is just temporary. When the swelling going down, then you can feel starting to feel back. But for the numbness, especially, it's different in every patient because when we cut the skin, we also cut the little nerve. So some patients complain that they still numb few months, they still numb a few years. So it's normal to happen like that.
Is there anything that we can do, doc, to ease up the, the process?
So actually that is normal body process always in every injury we make. It always take time 1 year to heal up. So if you want to enhance or fasten the process, fasting the process, that you can do some LED treatment or oxygen hyperbaric chamber treatment to increase the healing process. But
Speed up.
yeah, whatever we do, actually, as naturally, our skin and our body will heal up to 1 year. So this is like some, you can see the picture we already got from the patient who shared the picture for the face and neckline, how we corrected the jaw with the deep plane technique and the scarring. For the scarring or for the patient, they always mention what to do with the scar. I understand,
Yes.
but the scar is need process. So scar, the worst timing you will see become redness, it will be in the first 2 to 3 months. That is, you still, oh, why my scar is getting worse? It is normal process. You have to see minimum 1 year. So after 1 year, the scars is very faded, especially in Western people. In white people, they are very lucky because their skin is very good. The scar is really faded. Even you cannot see later after a few years. This is also some patient who have very heavy jaw, very heavy neck, very saggy. And then this one also you can see a progress from day by day. You can see, especially in the third day, the third picture, that is the second day after the surgery, that is very swollen and very like a chipmunk. It's all normal process. So if your swelling happen, just don't worry because it's normal to happen.
They're beautiful, doc.
The patient, so if you say that is my face will change, actually no, it's not changing your face, it's just make you go back to your time. Even the patient say, people have told me that I'm similar with my daughter. So it's just like that. So it's just
Very good.
restore, going back few years to go back to your face. We don't do any something that change your face. Even you ask me, I want to change my face to Kim Kardashian, and I'm sorry, I also cannot make it. So we just make your skin, your face going back to your
Prime time.
young age.
Yes.
I think that's all I can say. Thank you very much for your time.
Oh, that's very interesting. Okay, get back to you, Sherry.
No problems. Thank you so much. So we did have some questions that had come in from our team as well. And I think you've just answered the first one actually, which is the difference between the SMAS and the deep plane facelift. Our second question is actually about other procedures. So a lot of people have asked, is it possible to combine a procedure like a CO2 laser, some resurfacing, or any other minor procedures at the same time as we're getting a facelift?
Yes, it is possible to combine the procedure. Mostly you can, if the patient have problem with the brow, that droopy brow, we can combine also together with the brow lift in the same time. Also, who have like excess skin in the upper eyelid, we can also combine together with the upper blepharoplasty. Or if you want to leave, because when we are aging, not only the skin, but the distance between the nose and the lip also going further. So you can see that your lip looks like thinner. Some patient that we suggest you can lip lift, that we cut the skin and then to make like camouflage the lips, so it's like turn up position. Also, as I mentioned before, when you are aging, not only the skin is saggy, but you lost the volume. So that time we also can combine with the fat transfer. So we lift the skin and we put fat together to give like support of the skin after the surgery. For the razor facing laser, it's a little bit different. Some doctor do it in the same time for the razor facing laser in the day of the surgery. But for me, I wait about 1 to 2 months after the surgery because with the razor facing laser, we also make injury. Actually we burned the skin, so the skin is like peel off. But sometimes because of that, we cannot, a little bit difficult to see the complication. Is it because of the laser, or is there any bleeding inside or hematoma inside? And also, patient a little bit more uncomfortable. So for me personally, I suggest to the patient, if you want to do the laser, you can separate it like 1 to 2 months after. But any surgery area that we can still combine together with the facelift depends on the patient needed that time.
Okay, that's really, really interesting. Thank you so much. We have also just had a question pop up in chat around the risks of a facelift surgery. So what are the risks and the issues that people need to be aware of when they make that decision?
Okay, so for the surgery, all surgery first will be bleeding. So actually, in the facelift, bleeding not that much, but if you have like other uh, disease, let's say like high blood pressure or high blood sugar, or also you have blood thinner consumed in a long time previously, that also can increase the bleeding. If the bleeding keep going, and sometimes you have like hematoma or clot in your face or neck area. If that's happened, that might be we need to suctioning out the blood. That is the most common complication that might be happening in the surgery. The other one will be like swelling and bruises that up to few couple of months, and then also numbness. Numbness, it really depends in every patient. Some patient can get the sensation, but even after few weeks, there is patient can get some sensation after few months, but there are also patient permanent numb for the whole of their life. So what kind of numb, or are all the neck face is numb? Mostly in the incision area, they feel like a touch, but being not touched, that is one of the complication. The other one will be the nerve injury if using the deep plane technique. So because we open this mass, so if it might be that actually we always see when we open, we see every millimeters we open, we see where is the nerve. Of course, we don't want to touch it, but as our human body, there is always variation that we don't know. There is another nerve or variation nerve in not in normal patient, but some patient have it. In case it's being touched, mostly you will see like asymmetric when you smile, like one is more than the other. If it's happened, I see the patient like 90% is can come back after a few months. Very, very rare after they can become permanent. The other one will be the skin necrosis or the death of this aged skin, because when we cut the skin and we pull it, so we need a lot of blood supply from the inner side. If the blood supply is not good, mostly that you can see like some black skin here. If that is happen, don't worry, it needs to be peeled off first before it's healing. So that is some of the complication might be happening in the face.
Okay, that leads really nicely into our next question, actually, and that is around the recovery time and what would be required after the surgery. So obviously you're looking for these complications as well. So could you talk us through how long would somebody need to stay in Bali? What do they need to recover? properly and the appointments that they would need to have with you after the surgery?
Yes. So we suggest patients still in Bali 2 weeks, minimum 2 weeks after the surgery. If you choose our hospital, that your price will be already include 2 nights in our hospital. That is the most important time because we will see if there is early complication, we can detect in that day. That's why we ask you to stay in our place. After that, we will ask you to come another for check-up and then 8 days for stitches out. But we suggest still you have sparing 1 week, another 1 week. So at least something happened. There is another complication that you still invalid. You can help to manage before you going back to your country. So minimum 2 weeks is the best time to stay here.
Okay, okay.
Doc, how many times that the follow-ups are needed?
Mostly 2 times. So after you go home, you go back to your hotel, and 2 or 3 days, we will ask you to come again, and we will check, and then we ask you come for the last time to stitches out at 8 days after.
Okay, so they will stay at our hospital for 3 days and
Yes.
2 nights, and then after that, 2 days or 3 days later is the first follow-up, and then the second follow-up will be done average within 8 days period. Okay.
Okay, thank you so much. There is another question in chat as well, and I will just answer. This video will be available after this session, so we will be uploading that. But we have had a question around, is there any times when this type of surgery, a facelift or a neck lift, is not successful? And how do you handle revisions for those kind of cases? What would cause something to be not successful?
Okay, so for the facelift, we always explain to the patient. Every patient condition is always different. Even we use same technique, best technique, because we also don't want patient have revision. We also want one surgery that make them happy. But we have to understand every people's skin is different. So some patient, even in the same age, the skin quality is different. Some patient, the skin is thick, some patient skin is very thin, some patient, the skin elasticity is still good. Elasticity means that the plump of the skin, the better the skin quality, the better is the result. But if like it's very saggy, the skin is very thin, the collagen is very less, that you might need revision. Why we need revision? Actually, it's not because of the fail of the surgery. We always use same technique, how we pull, how we fixate. We always have some point in that area. But if your skin is not good enough to hold it, then it can be saggy again. In case you need some revision, we will only charge for your consumable fee and then anesthesiologist fee, but there will be no charge from the doctor again. Yeah.
Okay, thank you very much for that. And we have another question. This was from a registration as well. What can help to enhance your healing after surgery? So what are the types of things that people can do?
Okay. The most important thing in the first week is cold compress. So you can put your ice pack to the face area to reduce the swelling and to prevent bleeding. Ice pack is very important. The other you can use like another therapy like light therapy to boosting your collagen and also some like hyperbaric chamber also can help for the faster the healing. The other one is also wearing your facial garment. So facial garment is very important. Even it's not presentable to every people when you meet people, but that is very important because it will hold your tissue, reduce the swelling and bruises also better without you wearing it. So facial garment is very important. The other one is direct sun. So don't direct sun is very not good because the principle is we always avoiding heat up. The heat up, the more swelling. The heat up your body, the more swelling you have. So we also don't do suggest you don't have like direct sunlight, and also skin treatment. So as I mentioned, surgery is never can change your skin quality. So after your surgery, don't forget, keep your skin better. Do skin treatment, laser, use skincare is very important too. And then smoking. Smoking is not good. So please just stop smoking. Actually, we suggest always to patients smoking and alcohol 2 months after the surgery. And vitamin injection. So to heal up, to make it faster, you can use a vitamin injection or immune booster injection that we also can have in your hospital during your stay. Because vitamin C and the other vitamins, multivitamin, can help your body to boost your immunity and make the healing faster now. Like that.
Okay. We do have one really good question that's just come up in chat as well, and this is the opposite side of the surgery. What preparation is recommended? We have a guest arriving who's 10 days away from their surgery now. What kind of things can she do to prepare her skin and her body for having the surgery?
Okay, if already in that short time, actually there is no we actually suggest in that time you stop everything you do about the uh filler. Actually for filler, thread leaves, anything that collagen stimulation injection, we suggest you to
Mhm.
stop already long time from your surgery. Already 10 days before your surgery, you just like chill out, enjoy your life before after the surgery. Skincare, just normal skincare, no problem. You can continue. Stop smoking, stop alcohol already. If you have blood thinner, also stop the blood thinner. And then after that, just prepare everything you need. In your package, actually, you already include one facial garment, but sometimes patient wants to change it, like wash, so you can bring another facial garment from your home country. You also your medicines. So of course, because you travel in international place, other countries, so we suggest you bring your medicine, like basic medicine you always need. You can bring it also together. Of course, we have medicine here, but in case like you need emergency, like after you go back to your hotel, like you feel something not good in your stomach and everything else that you already prepare. But the other stuff, cleaning everything, we will also already will provide to you here. So 10 days, you just chill out, nothing to worry. Just enjoy the process because we always prepare everything in the best condition. Before your surgery, we will check you up, you will meet with our anesthesiologist, and we will never push someone to do the surgery if you are not in the good condition. So if we check and you are not in the condition, for sure we will postpone it. So don't worry, just relax and then don't overthink about the surgery. Like
Okay. Amazing. Thank you very much for that. I hope that that answered some of those questions. Just a really quick one. How long do we wear the compression face bandage for?
I suggest 24 hours you wear it for 3 weeks and then continue nighttime until 2 months after the surgery.
Okay, amazing. And then our last question, it's come through on chat again, but this is actually a very popular question that came through on the registration as well. And this is around the costs. And the question is, what are the costs of the facelift surgeries, as well as the cost of packages that are coming up? So Mita, I know that you might be able to help with this question, and then Rika as well. Could you answer what is a general cost? And we can talk about the new packages that we have also.
So I guess this is the ultimate questions. Yeah. So our package costs, the basic package cost, actually for the facelift neck lift start from Australian dollar, about 9,430 Australian dollar, and that package has already included the surgery. And then the 3 days, 2 night stay at the hospital. And also it included the consumables and medication. that goes along with it. And then we also have another package, which is we called facelift neck lift glam package. So on top of the basic package that already included that I mentioned before, it actually give another benefit of the 5-day stay post surgery at the hotel chose preferred based on your preference. And then also free immune booster. So the beautiful doctor here already mentioned that actually immune booster or injection of vitamin can help your speedy recovery. And the surprise is that the immune booster that is included in the package can be delivered or served at your hotel. So it's a home service. Yes.
That's great.
And
That's
also,
great.
okay, one more value, added value for the GLAM package is the airport transfer. As I mentioned before, many of the patients come to Bali alone as a solo travelers, and some of them even has never been in Bali. So don't worry, when you touch down at the international airport, Ngurah Rai, we are already collaborating with a very famous national transportation company, and they will pick you up and then take you to from the airport to the hospital.
That's fantastic. And I will just jump in because, of course, the BIMC, you're able to choose with your surgery, you're able to choose your choice of hotel level or accommodation level. Bali
Yes.
Luxe is also partnered with BIMC, and
Yes.
so we're offering our services there as well. In the Bali Luxe packages, you do receive all of your transfers. It includes all of your meals. We have a private chef, and the setting is more of a villa setting. So you can choose a private villa, or you can choose to stay in a villa that is only designated for medical clients. All of our water on our villas is filtered at the mains level. So that means all of your taps, like showers, kitchen, all of your bathroom taps, are actually very, very clean water. It is drinkable. However, we provide filtered water for you to drink as well. So you don't need to worry about your showers if there's water getting on your wounds or anything like that. And we also provide the daily LED treatments as well as your transfers in and out of hospital. We spoke a little bit earlier about the way that we personalize the cars for you depending on the type of surgery that you've had. And we can also take you to hyperbaric oxygen therapies if you're choosing an add-on every day as well. So really, really good package options. We always encourage you to do your research and absolutely choose something that is the best for you and that will suit you in the best possible way. And you can customize those packages as much as you like. So you can choose to stay with BIMC and come to us afterwards, or you can choose to have your surgery at BIMC, and we will give you your package before and after surgery as well. So completely up to you. We just like taking care of people. We want to make sure that you have a good experience in Bali and that you have a good experience with your surgery as well. I think that's all of the questions, and we're wrapping up right on time. I just wanted to say a huge thank you to everybody who did register. Thank you to everybody who did submit questions as well. And of course, thank you so much to Dr. Astri and for the BIMC team. I think this was really informative. I've definitely learnt some things as well. We've got some material that will be sent to everybody on this call following the webinar. So you'll have the brochures and the pricing and ways to book and everything through there. I think also for the people who did attend and submit questions, there's also some door prizes. So that will be sent via email. And thank you again to BIMC Hospital for providing those. But thank you so much. It's also to the behind the scenes Bali Luxe Med team. I know that you're all there making this work and getting everything set up. So we really, really appreciate all of the effort that has gone into today.
Sherry, I think we have a surprise for the audience.
Oh, excellent. Okay, let's see it.
Yeah. So you're going to announce it, or who are? I think we have a gift, yeah.
We do. So I think
Yeah.
I had just
From
mentioned that we've
BIMC
got
and Bali
some.
Luxe.
Yes, yes. So give me 1 second. I did mention that we had some door prizes here. So I think it looks like we are able to give those out actually. Um, may I just ask, is that a random selection for people who have assigned, or perhaps we will
Yes, I think
send right?
it will be random. And who's the lucky
Okay.
ones? I cannot wait.
No problems. Let me just go through.
Is it
I
me?
did. Maybe. So, what we will do is we'll make that selection. It's going to be a random draw from everybody who did attend today. So, thank you so much. And we'll send you that voucher on email if that's okay. So, then you can get in touch with us. We've made sure that they're valid until the end of this year. So, hopefully, you've all got a little trip booked to Bali. And I believe, correct me if I'm wrong, Mita, but I believe they are a voucher for a hydrofacial at the
Yes,
Cosmetic
correct.
Center. Okay, so that's a fantastic way to get in and oh, Sandy's coming next year. I'm sure we can extend that. It's a fantastic way to get in and see the BIMC facilities. The cosmetic center there is really, really beautiful and is part of their aesthetic offering. So we'll send those out on email. And thank you again, everybody, for attending. We appreciate your time so much. Thanks, everyone.
Thank you.
Thank you.
Bye-bye.
Bye.
Have a nice day.
See you later.
See you.